I had a patient who was is probably in his mid-40s, married for 15, 20 years, they must have 3 or 4 children or so, and he had come to my office seeking a male enhancement, and he was very depressed, and I could tell. And I had asked him what's happening and so forth. He says, well, things have changed over the years during my marriage, and he just wanted to do something. He didn't know exactly what to do, but he figured, well, let's try this male enhancement. Basically, what happened in his marriage is that, and these are his words, basically he said that he would have to beg his wife for intercourse once a month. I used to beg once a week, but he felt so depressed and rejected that he limits himself to once a month. That's not a good situation. So anyway, we had discussed the procedures. He decided to have 2 procedures because in essence he was basically at about the average 4 3/4 size. So if you see, there's a 2-dimensional circular circumferential chart here, and you'll see 4.5 and 5. This is the usual range of normal or average, between 4 and 5, generally between 4.5 and 5 more accurately. He was at 4 3/4, okay, 4 3/4, which basically is like this model here. This is a model that's 4 3/4 in circumference, okay? Now the normal range is about 4 1/4 to 4 3/4 or 5. So basically this is the range of normal girth, okay? So he had had 2 treatments. Now what had happened during his 2 treatments is that actually he went from 4 3/4 to this one 6 3/4. A very good gain for 2 treatments. That's 2 inches in circumferential increase. A lot of collagen production there. So basically he went from approximately this size, let's get the more accurate one. He was about 4 3/4. This is erect girth, okay? He went to this size, okay? Now notice the difference here. This is 6 3/4, 5 1/4. So he started out with this and ended with that, okay? That is an incredible increase in size. Now, what happened afterwards? Well, he had explained to me that, well, actually he came back a few months later, and he wanted a 3rd treatment because he actually wanted to get over 7 inches. He wanted this range now, from here to here, okay, which is this size, okay? So if you notice, he started out here. He is currently here in girth, okay? Now he wants to go from his original to here, okay? You see the difference, all right? Let's get this lined up, all right? He wants to increase, so he went from this size, about 5, to this size, okay? That's 6 3/4, and now he wants to go over 7, 7 1/2, okay? You can see the difference, okay? So there you have that. So then he came into the office. He wanted to have another procedure, and I said, well, what's happening with your wife and so forth? He said, well, my wife is upset that I'm coming in again because we cannot have intercourse for 21 days. And what that means is his wife's upset that she cannot have intercourse because now they have intercourse 4 or 5 times a week, okay? And there's a 21-day healing time, so he can't have intercourse for that time frame. So that's really positive. That's a really good situation change in his life. Now, if you saw him back then when he was depressed to now, he looks totally different, okay? Absolutely different. He has self-esteem. His confidence is way high. Now, why did this happen? What happened to his wife and his relationship? 2 things happened. Number 1, his attitude changed. When his confidence and self-esteem went up, I think that impressed his wife, and that's a plus for a woman to see that, okay? And secondly, this here size that he has definitely will stimulate more during intercourse. There's no doubt about it. And we're going to talk about that in more detail later, exactly why girth stimulates far more than length, penile length, in regarding sexual stimulation and so forth. We're going to go over that in a little while, okay? Now, let's move forward. That was my first story. But let's move on to some highlights, okay? The most important thing to remember in this whole video presentation is that the procedure, which I call the platinum procedure, is a medical procedure, okay? It's a minimally invasive permanent filler treatment, Okay, very important. Now, what are your options? You could have this minimally invasive procedure done to increase your size, or you could have surgery. There's all sorts of surgery available, okay? Now, they're very invasive and the risk goes way up, okay? What I offer in this minimally invasive procedure is no cutting, no stitches, no scalpels, no general anesthesia. That brings the risk way down.